Hi, my name is Dr. Phil Memoli, and this is part of a mini-series on dental health. And basically, in a earlier discussion we had of dental biocompatibility, we raised the question of are dental materials safe or are certain dental materials not safe? And what we basically concluded is that there's no such thing as one material being unsafe for everybody or one material being safe for everybody. The whole concept of dental biocompatibility essentially boils down to the fact what's safe for me, okay, dependent upon my particular DNA, my epigenetic expression of these. There's certain materials that I can eliminate, okay, that are safe for me. And there's certain ones that other people cannot. All right, so we need to find what's really safe. And a lot of people come in and they basically say, I want to have my metals removed, but I don't want metals placed back. I don't want any material that has any metal in it. I'm done with metals. And basically what I tell them is that the important thing is that even these things which appear not to be metals, like ceramics, composites, and porcelains, these apparently non-metallic appearing things, they contain metals. So what we really need to do is we really need to look at these and find what metal inclusions in these are okay with me. Okay, because a lot of these metals are actually trapped in a lattice so they can't escape from here. But there are other metals in there that are included, like silver, zinc, or tin, which people may be reactive to, that are placed into these ceramics. So because once these ceramics are put in the mouth, we don't want them to break. So we have to strengthen them with these metals. And people grind on these things, and when we first put the porcelains in people's mouths, they were breaking. So metals had to be added to strengthen them. So these metals are still there. Okay, the other thing which metals are included in these, as I said, non-metallic appearing things, is in the form of pigments. Now there's cadmium and cobalt chlorides and iron oxides, which are put in to give color to the porcelain. Okay, otherwise the porcelain would be clear. So we need it to match your teeth. So these things are also included in there to an appreciable extent. So although something appears to be non-metallic, there are metals in there. And the basic point here is that it's not that a material is completely metal-free, because there is not really one dental material, okay, out of the 4,000 or 5,000 dental materials on the market that are metal-free. What we really need to do is pick something that's safe for me or non-reactive for me, because at some molecular level there's metals. And I have people get the MSDS sheets on what's contained in the composites or ceramics, and they say to me, look, this has aluminum, look, this has barium, look, this has this. But see, the key question is, are these actually locked into the materials and they can't escape? Or the ones that can actually escape, okay, which are these few ones, can any of these harm me? So these are really the central questions, and these are questions that a good dental biocompatibility test will tell us. All right, so thank you. This is Dr. Phil Memoli. Thanks for tuning in. I hope I answered a lot of questions about metal versus metal-free dentistry.